Eastern equine encephalitis, also known as EEE or triple E, is a disease that affects people in the summertime and early fall seasons. More prevalent in wooded areas close to freshwater swamps and marshlands, this current issue has made recent news due to its lethal potential. On October 3rd, Massachusetts health officials pronounced the third fatal case of triple E this year. My name is Grace Yeh,
And I'm Megan Luce.
and in this presentation we will discuss the significant background information related to triple E, the professional stakeholders involved in battling this disease, and the proposal and implications of a health advisory plan.
Eastern equine encephalitis is most commonly known as triple E. It is also known as the sleeping sickness. It is the swelling of the brain that causes altered mental status, dizziness, fever, seizures, and coma. The triple E virus was first discovered in horses. Symptoms in horses are circling and aimless wandering. They will often look lethargic and out of sorts. Nervous signs appear during the fever that include sensitivity to sound, periods of excitement, and restlessness. Brain lesions appear, causing drowsiness and droopy ears. The virus further supports the importance of owners making sure their horses receive yearly vaccinations. Lastly, triple E has been researched for the use as a biological weapon. This aids to prove the seriousness of the disease and the effect it can have on a population. The virus is best described using the epidemiology triad. A vector is an agent, person, animal, or microorganism that carries and transmits an infectious pathogen into another living organism. In this case, mosquitoes are the vector. Triple E is carried by mosquitoes and transmitted to humans through mosquito bites. As I said previously, the virus originated in horses, which is why equine is one of the E's in triple E. So the hosts are humans and horses. The agent is triple E itself. The environment that best suits triple E is during the summer and fall until the first frost. Mosquitoes are out more at dusk and tend to be worse in areas near water. This year, triple E has been exploding all over the media because it is worse than ever because of how mild the winter was last year in the Northeast Kingdom. This is why they have sprayed for triple E as early in the spring as they did this year, because more mosquitoes had survived the mild winter. Human symptoms of triple E include fever, stiff neck, headache, lack of energy, brain swelling, also known as encephalitis, confusion, disorientation, coma, and death. The first recorded discovery of the disease was in Massachusetts in 1831. So recent reports of cases in Mass are bringing the health concern full circle, and we hope to more effectively battle the disease this time around. Between 2004 and 2006, there were at least 10 human cases of triple E reported in Massachusetts. In 2006, approximately 500,000 acres in southeastern Massachusetts were treated with mosquito adulticides to reduce the risk of humans contracting triple E. This map further supports the epidemiological triad and the definition of triple E. This graph shows where the cases of the disease are. They are mostly on the eastern coastal plains. This map shows that it is evident that the environment of being near water is very true. All the states on the coastline and surrounding the Great Lakes. Virus activity has been increasing in the Northeast states since 2004. It is definitely concerning that Massachusetts has one of the top 3 spots for the highest cases by state. You can see that Florida has the most cases by state, and this is because Florida has the Everglades, where there is a lot of standing water, which is more ideal for prime mosquito environment. When talking about triple E preventions, treatments, and cares, horses and humans are very different. In horses, prevention strategies include vaccinations. This is why I mentioned before that yearly vaccinations are very important for owners to take special care to. Humans, there's no cure, and treatment usually consists of corticosteroids, anticonvulsants, and supportive measures. Our article mainly spoke about the physical activity restriction and the effect it is having on communities. In this article, most towns require athletes to be off the field by 6:15 p.m. In some towns, they require athletes to be off the field even earlier, by 6 p.m. We think that it is a great topic to consider because obesity is such a major issue, and with the scare of Triple E, is cutting down on the prime workout time for people who enjoy running in the evenings. It is also creating chaos for athletic directors and facility schedulers. All in all, this is really turning into a huge barrier for communities to overcome to get their workouts in. It also forces those who work out at night to have to pay for gym memberships for more than just the winter months.
Several key players are involved in the fight against Triple E infections. First, for the majority of the work week, teachers, paraeducators, and administrative officials in schools remain in close contact with children. Children under the age of 15 are especially prone to infectious bites with Triple E. The cause of this age selectivity is unknown. The role of their educators, however, are critical in reinforcing preventive behaviors such as staying indoors as the sun sets or being diligent about wearing bug spray. Next, sports coaches need to adapt to the changing time of dusk as summer turns into fall. For them, this may mean rescheduling practices and games earlier in the day or canceling games altogether.
As I said before, athletic directors and facility schedulers have their hands full, especially when they're trying to schedule 4 fall sports teams onto one field. This has really affected football, especially because football is usually played and is a big deal to be played on Friday nights. But most football games on Friday nights are having to be played on Saturdays, changing up the tradition.
Doctors who see children may include a brief reminder or warning about the dangers of mosquito-borne illness, or to put a sign about appropriate clothing protection in their offices during the summer and fall seasons. Community health workers may likewise post notices in their main lobbies and speak directly to their guests about the dangers of viruses contracted through mosquito bites. And finally, public health officials must track the spread of swarms of mosquitoes, checking whether they carry the virus, and spraying the areas in which these mosquitoes live. As of October 15, 2012 this year, there have been 7 confirmed cases of Triple E in Massachusetts. 3 of those 7 patients have died of their illnesses. What preventive measures can be taken to best caution and protect the general public from this sickness induced by a seemingly usual mosquito bite? We propose a strategy for promoting the safety of the Boston public. In order to achieve this goal, we will first formulate a general advisory plan, which will require the consent of the Department of Public Health before its announcement in the neighborhoods which are under both critical and high threat levels of mosquito-borne illness. Our recommendations for the prevention of Eastern equine encephalitis will be summarized in a health advisory plan. This draws on the fact that individuals play an important role in their own protection, as well as the safety of their loved ones from mosquito-borne illnesses. Most of these recommendations are common sense, and they have been gathered from several trusted sources, such as the Massachusetts Department of Health and Human Services, the Department of Public Health Epidemiology Program, the Division of Animal Health, and the Arbovirus Surveillance Information Line. We made this health advisory plan simple to commit to memory. Just remember the ABCs of mosquito-borne virus protection. First, apply a trusted repellent that contains DEET, permethrin, picaridin, or lemon eucalyptus oil, making sure to follow instructions regarding age limits. Next, know that prime mosquito biting hours are those around dusk and dawn, so plan outdoor activities accordingly, avoiding the evening and early morning hours. Third, wear long protective clothing that minimizes visible skin area when you are spending a significant amount of time outside. Fourth, standing water is where mosquitoes like to lay their eggs. Homeowners should check their property to minimize the number of places that have potential to collect water, such as rain gutters, flower pots, and bird baths, and to make sure that those places are cleaned regularly or drained properly. This is especially important for animal owners who have buckets, troughs, and wading pools. These areas are excellent breeding grounds for mosquitoes, and thus they must be cleaned and flushed out on a weekly basis. This practice will be critical in the summer months to reduce mosquitoes. And finally, examine all windows, doors, and other openings through which mosquitoes might enter your household. If necessary, prepare your current screens or install new ones that fit snugly to keep the mosquitoes out of your house and away from your body. This advisory plan would need approval from the Department of Public Health. Following their consent, the ABCs of remaining mosquito bite free would be promoted in the schools and community health centers of first the towns where there is a critical threat of infection, such as Bridgewater, Easton, Halifax, Plimpton, among others, and later to those areas at high risk of infection, including Braintree, Canton, Duxbury, Freetown, as well as the ones you see on the slide. We wish our advisory plan the highest of success. In order to measure its effectiveness, we will need specific indicators to determine whether the intended aims of the advisory plan are actually met. We will design a short survey to be given to and taken by the residents of the towns of critical and high-risk threat levels for EEE infection. Also, we would ask for anonymous comments about the containment of and public health response to the disease in a space online such as a forum or a blog for suggestions and constructive feedback from the public. We would work with pest control to regulate the mosquito population next summer and to actively spray areas where we find mosquitoes that are positive for EEE or other dangerous viruses like West Nile. This will help also to contain the spread of the virus. And finally, we will continue research on this disease to better understand how to fight it and beat it once a person is infected.